I'm knocking on the door, open my door. And I'm closing my door to provide privacy for my patient. Hey, Mr. Smith, my name is Jamin Cooper. I'm from MCC. I'm here today to do some suction on you for your trach, because I see you're having some problems with your secretions. At this time, before I touch my patient, I will do some hand hygiene. Put this right here. Alright. So, well, this trach would not have already been on here. But since it is, I'm gonna use it. It's clean. Okay. Do 2 patient identifiers. Check first name. It's the right patient. His O2 saturation is at 96%. At this time, go ahead and do his assess his lung sounds. Keep it covered up for privacy. I'm gonna keep these right here because I'm gonna need to use them a little later. At this time, I will hyperoxygenate, which he'll be hooked up to some type of oxygen system. Hyperoxygenate my patient before I suction him. And also, I will come over here, wash my hands again, and I need to check to make sure the suction machines work before I set anything up. All right. This would be our tip that we need to use to check for our suction. We're gonna turn this machine on, and we're gonna occlude it to make sure it's between 10 and 15. No, 5 and 10. Turn our machine on. It goes between 5 and 10, or we can push it off like this also to check. Okay. I'm gonna put this right here because I have to use it in a few minutes. Okay, at this point, take these gloves off. Remove this, okay? This time I'm going to set up my sterile field with this sterile drape. Tilt this a little bit, make it easier. I'm going to remember that I have this 1-inch border to work with. So I can pick it up. This is out the way. Remembering I have this 1-inch border to work around so I don't contaminate anything. So I'm going to lay that down like that. And this will be the setup for my sterile field. Now I reach around because I don't reach over. Okay. At this point, I would dump this, which is sterile, onto my sterile field. And those are a pair of sterile gloves that I can't use, so I'm gonna have to dump. Okay. So this is null and void. So I can touch the outside of this box because the insides were sterile. So I'm going to pick this box up. I put it down. I'm gonna put it over here because this will be closer. Okay. This is some sterile normal saline, so it has not been opened, so I can pour it. Not twist this up, I can pour it directly in here, but if it wasn't open, I would pour some off and then use it, okay? Okay. This some more hand hygiene. Then I'm gonna put on my sterile gloves. Okay, now I can touch this because it's sterile. Okay, now I go in this field and I pull out my tubing. At this point, I'm trying to keep it rolled up because I'm gonna have to connect this to this. And once I touch this, it becomes unsterile. So, now I can hold it like this. Turn on my machine because, like I said, I'm not turning my back on anything. And that's because I said I would check my suction, okay? So it came undone. This time I will check my suction. Now include this hand. Suction is working. So I will go 4 to 5 inches. Make sure I don't need a resistance with the patient. I will not include until I'm coming out. So, alright, Mr. Smith, about to do your suction real quick, okay? So I'm going in 4 to 5 inches. And as I'm pulling out, this is when I will start my suction, okay? I'll wrap this up just to hold. Now I will reassess my patient. Sounds fine. And I'm going to close back up because he's getting a little exposed. I can turn my machine off, and I also check my O2 saturation, which is still sitting at 96. So at this point, I can disconnect this because my patient is breathing fine, okay? Put this back on him. Secretion is clear, so I'm done with all of this. And at this point, ball this up. Throw it away. We perform hand hygiene, of course. Put on some more gloves and take my goggles and mask off, and also all this PPE. And now I'm done with Mr. Smith, and make sure I just continue to check on him.